Happy Sunday, you guys! Alexa Simos here, licensed therapist and certified alcohol and drug counselor, and you're watching Not So Scary Sundays, our Sunday breakdown of common issues that affect our mental health. Before we get started, if you guys could do me a favor and go ahead and hit that like button so that YouTube knows we exist and that we're here every Sunday morning. This way, they'll push the content to more people and we can grow. For those of you who are subscribed, thank you so much for your continued support. Make sure your notifications are on so that you always get an alert every time we release something new. Now, let's get into it. It's no secret that this year has taken a significant toll on us, physically, emotionally, mentally, and just basically any other way you could imagine. Think about it. Toward the end of 2019 to 2020, we were receiving new pieces of information every day that impacted our routines and basically our ability to survive. CNN had a death counter tracking both globally and nationally, and we were just assimilated to that, thinking by the end, oh yeah, that's normal. Well, if you needed to hear this from me, it's not. Cohesively, we all endured isolation, fear, uncertainty, loss, and stress. And while we have scientists and top medical professionals working on managing this rapid virus, there's another focus that some researchers have been drawn to, which is the mental health pandemic that rose as a result of coronavirus. According to surveys administered in January and February of 2020, they found that people were experiencing more significant mental health symptoms than ever before the pandemic. This included high symptoms of stress, anxiety, depression, post-traumatic stress disorder. Up to half these individuals reported serious signs of depression, while up to 35% reported anxiety. And studies found that this stress and anxiety fueled crazy vicious cycles. The more we lay awake at night during the pandemic, reliving the worries we have to control over, the worse our mental health becomes. And with anxiety and depression dominating the research study above, according to the APA, American Psychological Association, psychologists saw a rise in clients who presented with both depression and anxiety throughout the pandemic. Of the psychologists who provided treatment for anxiety disorders, nearly 74% reported an increase in demand for such treatment, while 60% of those providing treatment for depressive disorders saw an increase. Further, this study showed that nearly 25% of individuals in the US were reporting depressive symptoms, which was 3 times the number of cases prior to COVID. So, though the mental illness isn't a new phenomenon to the pandemic, the circumstances that resulted significantly exacerbated symptoms for people. Loneliness, isolation, grief, increased substance use, it starts to impact our ability to function within society and could be more damaging to our health both physically and mentally. It's no secret that mental illness can greatly impact our physical health and put people at risk of a host of physical health problems, which can in turn affect their ability to work, maintain social connection. And though one may experience some symptoms of anxiety or depression, the pandemic intensified those symptoms, creating a bigger storm inside ourselves, impeding on our ability to function, or really maybe even our motivation to function. I don't know if any of you were guilty of this, but I know I was consciously scanning my body whenever I felt the smallest ailment or possible symptom of COVID. This hypervigilance is exhausting, and that was not only the curveball that the pandemic threw our way. Every day we were told new information regarding the virus and creating a bigger anxiety bubble surrounding ourselves, constantly playing the what if game. And then when things did happen, there was a sense of panic, failure, loss. I say this to say that the pandemic threw situations in our way that tested our strength and our ability to navigate through some of the toughest incidents. As Jessica Gold, an assistant professor of psychiatry at Washington University in St. Louis said, "There's only so long you can run a marathon without your body giving way, and especially with a constantly shifting finish line like we have during the pandemic." Gold further goes to state that we don't talk enough about how this pandemic has been basically one big traumatic event with lots of little traumas within it. There are a lot of people suffering because of that right now. Trauma is not just an event you have to witness in person, like how it's demonstrated in Hollywood and our favorite army movies. However, watching the news or vicariously knowing someone with COVID could be traumatic. The APA reported that there were an increase in demand for psychologists who worked with trauma and stress-related disorders, which was about 48%, and for sleep-wake disorders at 51% throughout the thick of the pandemic. According to the Centers for Disease Control and Prevention, as of June 2020, 13% of Americans reported starting or increasing substance use as a way of coping with stress or emotions related to COVID-19. The stress of getting through the day could be coped by using illicit drugs or drinking more alcohol than you were used to prior to the pandemic. There are correlations in the research that link the stressors of the pandemic to the increased substance use behaviors, but also the exacerbation of those who already were struggling with a substance use disorder and having to endure the changes that came with the pandemic, such as isolation, and that only intensified. So with all of this overwhelming negative content, where do we go from here? Well, here are just a few suggestions. Number 1, be aware of the media and information that you are taking in on a daily basis. Limit your media time, or should I say certain media. Curate your time on your phone or TV to maybe more positive content to avoid certain channels or shows that might trigger you to continue to dwell on the negative impacts of the pandemic that is forced upon us. Until you start to recognize how much negativity we consume on the daily, you start to notice how prone you are to thinking that that is the way it has to be. Number 2, find a safe person or a group of people that you can turn to and feel honest about sharing your thoughts of how you're functioning throughout this time. I know this might be overwhelming, but there is nothing more eye-opening than expressing yourself and feeling heard and understood. This doesn't necessarily have to be a professional, but someone to provide support or a positive relationship that brings you joy. The power of sharing our stories is often forgotten, and while we get through this pandemic together, we can learn more about each other's experience through connection and vulnerability. Number 3, continue daily exercise. Regular exercise can have a profoundly positive impact on depression, anxiety, and ADHD. It also relieves stress, improves memory, and helps you sleep better while boosting your overall mood. And you don't have to be a fitness fanatic to reap the benefits. Research indicates that modest amount of exercise can make a real difference. No matter your age or fitness level, you can learn to use exercise as a powerful tool to deal with mental health problems, improve your energy and outlook, and get more out of life. Number 4, consider seeking professional help. If one light came from this pandemic, it was the use of telemedicine and the great convenience it has on maintaining the appropriate social distancing policies that have been enforced on us. According to the APA, 96% of psychologists were treating their patients remotely, while 33% were in a different state from their client. The ability to be connected within a network for professional health is astonishing, and in that way we can receive help at a click of a button in the comforts of our own home. Number 5, if you believe you or someone else is at risk to hurt or kill themselves, please call 1-800-273-8255 for the National Suicide Prevention Lifeline. And you can also text HOME, HOME, to 741-741 for free 24-hour support from the Crisis Text Line. Please use this support if you feel like it's needed. I know this was a really heavy episode, and this was just an overview of some of the ways the pandemic has impacted us. Depression, anxiety, post-traumatic stress disorder, grief, substance use. That's just a handful of what came our way during this incredible, crazy time, and we're still in it. If you have anything to add on this topic, please leave a comment below. Remember, this is a community for support and to not feel alone. Let's be kind to each other during this still unpredictable time. Here's to good health and feeling heard. And on that, I'll see you guys next week.